A report shows that Alabama has high rates with people who have HIV in rural areas. This afternoon, Sarah Drake spoke with a representative from Medical and Advocacy Outreach about why that is.
The Alabama Department of Public Health released reports for the period of January 1st through September 30th, 2019 that stated there were 390 confirmed new HIV diagnoses, with 15,041 prevalent cases and 22,314 cumulative cases.
The reports, data, the assessments, the groups that met to compile information identified that there were 48 isolated counties that needed additional focus. There were 7 states, and Alabama is one of them, particularly because of the rates in rural communities.
Stevens tells me that many times people have forgotten that HIV is a pandemic, and over the last 30 years with competing public talking points, it's been overshadowed. But now in this day and age, it's a concern on a national level.
HIV is critical, and addressing it is critical. The people that medical science did not advance fast enough to save, we will never know their potential. So we have to make sure those living with it today live the best life possible.
Stevens also tells me that in terms of treatments, there are conceivably 30 different pill-based treatments on the market, but there are different factors that go into determining which one is best for a person.
Often the providers or the doctors, the nurses have to do is to align which of them works best with that particular individual's chemical makeup, because each of them are going to have varieties of side effects. You also have to align with what other health conditions they're on.
In Dothan, Sarah Drake, WDHN.
December 1st.